Hi everyone, I want to talk about bleeding in elderly. Why will I limit it to bleeding in elderly? It could be bleeding in anyone or bleeding in general. I'm limiting it to elderly because sometimes this could be confusing and elderly people may find it strenuous. Their families, then caregivers will be rattling. What could be responsible? Okay, let's go. Bleeding in elderly. So I'm not talking about bleeding generally in everybody, not in children, but in elderly. What are the possible causes of bleeding in elderly women or men? One, cancers. Could be bladder cancer or carcinoma, could be renal carcinoma, cervical carcinoma, vaginal carcinoma, could be fibroid, could be endometrial cancer, colorectal cancer, prostatic cancer, benign prostatic hypertrophy, could be hemorrhoids, or could be anal fissure. These are some of those things that we're going to work upon one after the other, depending on the history and physical examination before trying to rule out any of this. But not only this, we have more on the list. It could be as a result of bleeding dyscrasia, von Willebrand factor, hemophilia, disseminated intravascular coagulopathy. We're going to look for the cause. Could be as a result of sepsis, thrombocytopenia, liver failure, or even trauma. This could be as a result of elderly abuse or medications. Medications like anticoagulants, heparin, warfarin, aspirin, or the NSAIDs generally, non-steroidal anti-inflammatory drugs, antiplatelet like clopidogrel, thrombolytic agent like RTPA, recombinant tissue plasminogen activator, TNK streptokinase, and so on. And could be as a result of peptic ulcer disease or malarial tear in esophagus from recalcitrant vomiting, Webby syndrome in esophageal rupture. Still possible causes could be intravenous malformation, esophageal varices, alcohol abuse, renal disease as in case of polycystic kidney disease, hemorrhagic telangiectasia. One other cause in women is atopic vaginitis. In that case, the woman will be in menopause, and that will be associated with flushing, dryness, decreased libido, increased urinary frequency, change in the mood, dyspareunia, increased estrogen in mid-cycle, infections, vaginosis, candidiasis, gonorrhea, and chlamydia. I have a separate presentation on menopause, so you can check that out. How will this likely present? If it is upper gastrointestinal tract bleeding, there's possibility of vomiting blood called hematemesis. And there could be coffee ground vomitus with stool that will be black and tarry, Elena. There's possibility of hematochezia, that is red blood is stool if it is lower GI or the upper gastrointestinal tract bleeding is massive. and the effects will be dizziness. The elderly man or woman will become pale, feels tired the more, and lethargic. The blood pressure will be down, the heart rate will go up, urine production might decrease or completely stop. The individual could be fainting and falling, can go into coma, or actually die if no intervention on time. How do we intervene? We take history, physical examination, and check whether or not the individual is pale, and we're going to treat any situation as case-by-case issue. We stop any medication, we treat underlying pathology, admit if required, give intravenous fluid or nasogastric lavage as may be appropriate, check the complete blood count, group and cross-match if it is massive, catheterization, proton pump inhibitors like omeprazole, and of course endoscopy to find out where the problem is. We can embark on transfusion depending on our findings or stability. Ultrasound as may be required, liver function test if we suspect is as a result of problem with the liver, renal function test, INR and PTT, haptoglobin if we think there's intravascular hemolysis and haptoglobin will be dropping. Reticulocyte count, we expect it to rise in hemolysis, and of course septic workup when we suspect sepsis. Surgery as it may be appropriate, octreotide, with or without antibiotics, like I've said, is case-by-case issue, and the treatment is going to be on case-by-case basis. It depends. So it's not a general thing that we have to do all this, but we select what we're going to do out of this, or even out of this scope, we can do more. So we might involve gastroenterologist if it is related to that, or gynecologist if it is pointing to that. Then some will give tranexamic acid depending on where the bleeding is and how massive. We review the investigation results and embark on definitive management of the exact cause. And of course, it is going to be wise to refer appropriately and on timely basis for that matter. Okay, in conclusion, the list above is not exhaustive. Finding the exact cause is vital to a true relief. Help that grandpa or grandma out. Thanks for listening. Kindly subscribe so that you can get these publications immediately they are released. Thanks.